Scottish Rite Hospital on another episode of SRH Access, and I'm here with Dr. Steve Richards. Welcome.
Thanks very much.
We're so excited to have you. This is your first time on Facebook Live.
It's good to be here.
Yeah, we're here actually in one of our casting clinics. So what happens in here? Why don't you tell us a little bit more about it?
Well, this is one of our cast rooms actually. We see that babies come in here and we do the casting in these rooms. We're stocked with our plaster supplies and all of our sinks are prepped for all the plaster supplies. So we do our work in this particular
Fully equipped.
Fully
ready
equipped.
to go.
Right.
So before we get started, we're trying to take live questions. So if you have a question about clubfoot, put it in the comments below and we'll make sure to ask Dr. Richards today. So today, everything is clubfoot. Let's get started.
Sure.
What is clubfoot, Dr. Richards?
Clubfoot is an abnormality of the foot that the baby is born with. It's often picked up prenatally on the ultrasound that's done at about 20 weeks. And so I actually will see a number of children not yet born. I see their moms who come in and we do a little bit of a consultation ahead of time to discuss what we're needing to do. And we go over the models like we have here and sort of put moms at ease a little bit so they feel a little bit more comfortable having learned a bit more about it. So a clubfoot is an abnormality where the foot is turned in like this, pointed down like this, and it doesn't hurt. The baby's not really aware of it, it's no pain. But our goal is to take this foot and make it into a normal appearing foot. And we do that through a series of cast changes, stretching and cast changes, in an effort to get that foot corrected. That's a clubfoot.
Wow. Okay. So then, does it happen on both feet, one or the other? Could it be both? You know, what is the chances of that happening?
So we see it a little bit more frequently in boys.
Okay.
Occasionally there's a family history of it, so there can be a genetic component that leads to the clubfoot in the future generations. Most of the time we don't have that positive history in the family. We see it in half of the patients one foot,
Okay.
and half the patients both feet.
Okay.
So it presents either way. Most of the time the kids are normal in every other way. So it's picked up on an ultrasound, say at 20 weeks when mom is pregnant. The ultrasound is then repeated with a little bit higher resolution technique. And the ultrasonographer scans very carefully to see if there are other associated abnormalities. Most of the time there are not. It's a simple problem that involves one or both feet.
Okay, so a mom who has this 20-week checkup in clubfoot, you know, it's possible if they see it on the ultrasound. How are they getting to Scottish Rite? Are they getting referred from their doctor to come here? What maybe can you tell those moms out there that might be going through this right now?
Sure. A lot of the times it's through their pediatrician.
Okay.
A number of times it's through the internet. And they may find our site there on the internet and they come here for that, or it's through their pediatrician.
Okay. And so getting into more of the condition, what is the possibility of damage to maybe some of the baby's, the tissues or the blood vessels that are inside of the foot?
Well, most of the time there's something that is not developed properly in the leg and in the foot. We don't know what it is necessarily that arrested that development, but it's seemingly like a normal foot, but something prevented the normal progression of the normal foot development.
Okay.
So the blood vessels are there, the tendons are there, the nerves are there, they all function, but they're very tight and fixed in a position like this. So our goal is to gradually, gently stretch this over into a position that allows for correction. And our attempt is to avoid an operation of the foot.
Right, definitely. And so once a baby is born and they have clubfoot and they come to Scottish Rite, what is the steps of possible treatment? And is it a week after they're born? Is it the next day? Or?
Yeah. We'll tell mom that once her baby's born, we'd like to see them within the first couple weeks of life.
Okay.
And we'll begin the stretching at that time. The baby's relatively small and thin, and that helps us as we put casts on, and I'll show you an example of that in just a minute. But if we see a baby who's 3 months old or 6 months old who's been nursing a lot and is somewhat pudgy, then it's a lot harder to keep the casts on.
Yeah.
They slide off. So we like to see them within the first couple weeks of after they've been born.
Okay.
And then the method that is most commonly used in the country and basically worldwide is
Mhm.
called the Ponseti method.
Okay.
So we do that here. We went up and we trained with Ponseti when he was up in Iowa. I got to know him as a colleague and as a friend, and we'd have some dialogues together. But that's the most common treatment method. Another method that we've also used is the French physical therapy method. But by and large, most families are better versed with the Ponseti method and prefer to move ahead with that.
Okay. So what is the step of the Ponseti method? What does it look like?
Sure. So Ponseti method is a manipulation of the foot. So you have a newborn who has a foot like this, and through a gentle process, we will stretch the foot gradually into a position such as this, and we'll apply a cast. The cast comes above the knee like this. And then a week later, after that's had the stretching, we take the cast off and we manipulate it further. So after the course of several casts, we've taken it from there to here, and we take it way out to the side. So after 3 or 4 or 5 casts, we have a foot position similar to this, and it's still down. And so then we put some numbing medicine on the skin, we clip the heel cord, and we can bring that foot up so that we can stretch it up and get the foot flat to the ground.
Okay.
So after somewhere between 6 and 8 weeks total,
Mhm.
the cast is on, and they're finished with the casting.
Oh wow.
So once we clip the heel cord, the last cast stays on for 3 weeks while the heel cord mends back together. So when the foot is corrected,
Mhm.
after this 6 or 8 week period of time, we then move into a special shoe. This is what we put the clubfoot baby's feet in.
Oh, okay.
We keep them turned out in a position similar to what the cast does. And they stay in this, and they wear that full time. They wear it in the morning, in the day, at night. So they wear it full time for the first 3 months. They come out of it for 30 minutes every day, 3 times,
Oh wow.
so that the skin can get a little bit of relief from the pressure.
Right.
And after 3 months of doing that full time, we go into a nighttime brace, which is the same brace.
Okay.
And they use that up until the age of 2 to 4 years. So as they get bigger, you can see that we size the braces bigger. And each time they come in, we assess the fit, and as they outgrow the brace, they get into a bigger one. So that's the process, really.
Yeah.
Yeah.
That's pretty straightforward.
It is.
So when they're first put into this Ponseti casting, how often are they coming back to the hospital to get that changed?
So we see them each week.
Okay.
So my plaster clinic, for example, is every Wednesday afternoon. So
Okay.
the baby comes in, we put our first set on, and then we see them the following week. And after 3 or 4 weeks of that, we're ready to clip the heel cord, stretch the foot up, and put the final set of casts on, if it's bilateral or just one side, if it's one foot's involved. And that cast is worn for 3 weeks here.
Okay.
So then they come back here in the clinic, and we remove the cast. A simple saw
Mhm.
removes the cast. It's done safely. We make sure the skin is well protected. It's always a concern a parent has when they see a cast saw. They think, wow, what's going to happen? But we do very carefully remove the cast, and the skin's always very carefully protected. And so that cast comes off. They go downstairs to our brace shop here at the hospital. They get their brace. It's fit down there. We see them back up here in clinic. Make sure the fit is proper. Make sure mom and dad understand the instructions well. And then we transfer a fair amount of the responsibility of having gotten the foot corrected
Mhm.
to them to maintain the foot corrected.
Right.
And they maintain it by being reliable in the use of the brace.
Right. Because you're not seeing them every week once they're
No.
in that brace.
Right, we see them each month for the first 3 months,
Okay.
and then every 3 months.
So then, what about, long term? Are these patients seeing you until they're toddlers, into adolescents? What is kind of the monitoring
Sure.
of clubfoot?
Well, we are studying our results of the club feet, so we follow them a long time to see how well it's all working out. But after that 2-year period of time, where we've seen them every 3 months, some families elect to use the braces a longer period of time, some do not. And
Mhm.
it's a challenge to get them to wear the brace reliably, even up to 2 years of age.
Right. Because they're starting to move around. They're starting to walk.
Yeah, and the child doesn't really want to wear it.
Right,
And so
yeah.
mom and dad really have to make a diligent effort to do that.
Okay.
And that's not easy. And some follow through beautifully, and some struggle with that. And if the brace isn't worn, the foot has a potential of coming back.
Okay.
And then mom and dad may see that and say, let's put it back in the brace. And by that time, it's too late because the foot is a little bit tighter,
Mm-hmm.
the baby's a little bit fussier. So we have to sort of repeat the process at some intervals
In older
with some
age.
patients. Yeah.
So this is obviously very common in babies. Is it
About 1 out of
possible?
1,000.
So is it possible for a baby that's a little bit older, maybe 2, for it to kind of come about, or is it only when they're an infant?
Well, they're born with it.
Okay, so
Yeah. So,
only born with it.
but a foot can be corrected and then relapse,
Mm-hmm.
so it can return to a partially clubfoot position.
Okay.
And that requires more intervention. We try to recast that out and improve it that way, but if it's too tight and it hasn't worked, then we have to do some limited amount of surgery to the foot.
Okay. So then, what's maybe some of the long-term problems that
Yeah.
clubfoot can bring?
Well, first of all, I tell you that the long-term sort of opportunity for the baby and for the family is great. So whereas 2 decades ago, a lot of surgery was done for club feet to get the foot in the right position, and it worked, but it made the foot stiff.
Okay.
So as the babies would be out there playing at age 8 or 10 years old, they'd come in and the foot would be stiffer and be less comfortable. They'd complain of pain.
Right.
So if we can avoid big surgery to the foot, then we do. So we get the foot corrected, and a number of the kids are going to do great and basically function normally. So the foot looks normal, functions normal, although it's never fully the normal foot. It seems
Okay.
to be so.
Seems to be, they can be active and live a.
Yeah,
Normal life.
they've got a great opportunity for normal functional feet.
That's awesome.
Yeah.
I think we just got a live question, so this is exciting. Let me see what it says. Okay, once the brace is worn for 3 months, are there special shoes that the baby should wear?
So once the baby has completed the full-time use,
Yes.
and then goes to just nighttime use, that leaves them the full day to be in whatever they want. And so I'll tell mom that she can have whatever she wants on the foot at that time. So the baby could go barefoot, the baby could have whatever shoes they like. So during the time they're out of the brace, after 3 months, anything's fair game.
Okay, so you don't recommend maybe,
Stride rides or
yeah,
nothing.
maybe
No.
some flip-flops or nothing in particular?
No,
Okay.
everything what mom and dad choose.
Okay, very good to know. All right, so I think as we're starting to kind of wrap up our clubfoot session, maybe let's get into some of the research
Okay.
that we do here at Scottish Rite
Yeah.
for this.
Well, since we embarked on the non-operative method, working with Ponseti 20 years ago, we've enrolled patients who come here into a study. So we have a database of 1,200 patients
Oh, wow.
who are normal kids with club feet. And then we have a couple of hundred patients who are not normal kids who have club feet.
Okay.
So we've been able to follow the status of these children and realize what percentage are successfully treated with this, what percentage relapse and require more treatment, what percentage need some surgery. We've looked at the kids to see how their function is in our movement science lab.
Mhm.
Yeah, so Dr. Carroll, one of my partners, has done that and published on that quite a bit. So we've learned a lot about club feet. We still don't know the cause of it. We do have the opportunity to look at some of the genetics of it, and we're doing some research with that with Dr. Jonathan Rios, who
Okay.
is with us in the research department. So there's a lot of exciting research that's going on with club feet. We want to understand it. We want to conquer it. We'd love to prevent it,
Right.
but I don't think that preventing it's going to happen in my career.
But it looks like we have a really good plan.
It's
So
great. It's a great
parents shouldn't
treatment
worry.
program. Parents shouldn't worry. We can get some really great results with this. I'd be optimistic, and that's what I tell every mom and dad who comes in.
That's awesome. Well, thank you for joining us today.
Yeah, it's
This
a
was
real
a
pleasure.
great session to learn about clubfoot, and we're excited. SRH Access. Tune in next week. We'll be back. Thank you again.